Take a seat.
I want to thank all of you for coming at very short notice. As I mentioned earlier, we have arranged for this briefing to give you an update on the measures that we have taken and will be taking to deal with this public health threat caused by the Mexican swine flu. As you know, Singapore experienced SARS in 2003, and since that time, we have been working in earnest to prepare for a flu pandemic that may happen to us. And we began drawing on lessons that we learned from SARS, and we now have a better understanding of the issues. We have set up a home front crisis management system to deal with major crises like this. And I chair the Home Front Crisis Ministerial Committee. That is also a committee chaired by the PEMSEC, comprising officials from practically all the ministries in the government. And through these years, since 2004, we have put in place many plans, and we have tested the plans, and we have practiced various scenarios, just to make sure that we are ready to respond to any crisis such as this kind of transmission of Mexican swine flu. We are treating this outbreak not just as a medical problem. We have to deal with it as a total problem that require both medical and non-medical intervention. We have medical response plans and non-medical response plans. We also need to have population response plans, particularly in regard to making sure that we can continue with our essential services. Otherwise, we'll be ground to a halt. By the nature of flu virus, I don't think we can confine the Mexican swine flu to isolated clusters like SARS, where we can immediately find the people, quarantine them, and then separate them from the community, particularly when the transmission has become very effective and there's a human-to-human transmission that spreads very fast. But we can take some precautions at a personal level in particular. Personal hygiene is very important. So practicing good personal hygiene, washing hands, seeing the doctor immediately when one doesn't feel well, and then listening to the doctor's advice, wearing masks if we feel that we want to cough or having flu symptoms, we can probably minimize the transmission of the virus in the general population. So an important part of it is really the population, to be able to take precautions and not to pass on the flu that they have with the people whom they come into contact with. We will, as a government, also keep our people informed from time to time and when necessary on the latest situation, and to let them know what we are doing and tell them as much as we can. Our ability to respond effectively to any severe pandemic will certainly depend on the extent in which we can get cooperation from not just the people, but also the public and private sectors, particularly the employers and the companies, and more so among the essential services. For businesses that are essential to our survival, we must make sure that they have business continuity plans in case some of the staff get infected. In other words, they have to have people on standby, ready to take over, and take the necessary measures to ensure that they do not cross-infect one another. We do that for the government. We have done that for the ministries, and we have standby teams ready to take over. We will have standby operation centers just in case. And we have been exercising in many areas, in particular in schools, for example. We have got our school children getting used to taking the temperature. But when we have hand-foot-and-mouth disease outbreak in kindergartens or childcare centers, and one of the things they do is to clean up the place and take temperature and take the necessary precautions. As you heard Dr. James just now, there is currently no case of Mexican swine flu in Singapore. So we haven't got a case in our community yet. But nonetheless, in the last week or so, we have primed all our medical practitioners to be ready to watch out, to monitor, and to report cases which they think may be symptomatic of flu virus like the Mexican swine flu. We have also taken many measures in the hospital level to raise our guard against any possible transmission, just in case. So disease surveillance is very important, not just locally, but also to know what's going on in other countries. The top priority in our plan is to make sure that we can respond via medical responses. And therefore, as you have been briefed earlier on by Dr. James, you have seen that many measures are already in place. We have also put in other measures. I think those who come in from the airport will know that a few days ago, we have set up temperature screening at our airport. We'll be also deploying similar thermal scanners at our ferry checkpoints. And for some years now, since the last experience we had, we have been stockpiling Tamiflu. So we have more than 1 million doses of Tamiflu available to deal and to treat our patients. I want to emphasize here that the government is taking this very seriously, and we are deploying all resources across the government to manage this disease should it come to Singapore. And our responses so far, I would say, have been quite swift and quite comprehensive in light of the experiences and the lessons we draw from SARS. So at this point, all of us should be alert, but should not be unduly alarmed by what is happening, but just be alert and be cautious and be vigilant. We are better prepared today than when we were in February, March, April 2003. So having been through that myself and having chaired the committee too, I know that at least we have done something more than what we used to know. So let me emphasize again, everyone must take precaution, and only then can we hopefully minimize the transmission of the virus among the community. But with any human flu pandemic, there are many unknowns. We cannot anticipate all kinds of situations. But we have to find ways of dealing with them when we are confronted by them and try to anticipate as much as we can. Despite all the measures we have taken, I want to emphasize that we must not be complacent that the virus will not come to Singapore. We are a very open society. Many people come to Singapore. Many Singaporeans travel overseas and they come back home. And with the transmission being so efficient among humans, it is possible that we can get hit by the Mexican swine flu. And when that happens, we must face up to it and deal with it. And as a community and as the people, we will have to learn how to adjust. So I stop here and ask that Mr. Kopunwan to say something, because he's also actively involved in dealing with this.
Yeah, thank you. Let me join DPM Wong in re-emphasizing that I think we are certainly much better prepared than 6 years ago. But we must not be complacent, for the simple reason that this Mexican swine flu is not the same as the SARS virus that we had to deal with last time. I think we did well last time, but there was an old war. This is a new war now, and we have to adapt our approach to face this new enemy. And in many ways, this new enemy is much more difficult than SARS. I would stress 3 points on why it is different and more challenging to deal with. I think first, this swine flu is a lot more contagious. You look at how fast it has spread around the world to several countries now, and the speed of spread. And secondly, as you heard from the earlier technical briefing, that unlike SARS, patients can be infectious even before symptoms appear. So what this means is that border control cannot be foolproof. It does not mean that there's no value in border control with temperature screening, because it will still allow us to at least pick up those who are already feverish. But it is not foolproof. So there will be leakages through the borders. And I think third complication of the flu pandemic is that historically it tends to come in waves. So remember SARS, we had a big fright, and we won the battle, and it just quietly fade away. Whereas flu pandemic, unfortunately, has a habit of coming in waves, and sometimes the initial waves may look mild, so your guts are down, and then the second wave can then be quite lethal. So this third difference means that dealing with this swine flu pandemic is likely to be long drawn. I think we must be mentally, physically, psychologically prepared for a long haul. So it is not a one quick battle and then we move on. Of course, at the same time, fortunately, I think with the SARS experience, the world is in a much better position to deal with this new enemy. I mean, in two ways. For example, I think the world, especially the government and the hospitals and scientists, are much more networked now operationally, and with WHO providing very good and sound leadership. And secondly is, in the last 6 years, I think the scientific laboratory capabilities have been enhanced significantly. You just look at, over the weekend, the genome of the virus was deciphered and published on the website. The importance and advantage of that prompt action means the scientific community and the pharmaceutical researchers can then proceed to get on with their research work, and hopefully within the next few months go into commercial production. So I think those are the key changes between SARS and the swine flu. The bottom line is this is a very dynamic situation, but it does not mean that a global pandemic with very high death rate, as what happened 90 years ago, is inevitable. It may happen, then again it may not. A lot depends on how the world responds to it. I think if countries and the people within the countries work hard together, cooperate, and do what is right, we may be able to reduce the casualties and the fatality. I joined DPM Wong in alerting Singaporeans that while today we may have no confirmed cases yet, but we are such a global city that you are plugged into the whole jet airline network, that it's a matter of time when some of the cases, maybe without fever, presentation, just walk across our borders. And the next moment they'll be in our community, and they may start causing local clusters. I can only appeal to those patients who have fevers to be, I think, act on the side of caution, that if you feel feverish, coughing, sneezing, I think immediately get in touch with your doctors. And if it is confirmed or suspect to be swine flu, at least quite unlike SARS, now there are medication for it. The studies suggest so far that Tamiflu and Relenza are reasonably effective, provided the treatment commences as soon as possible, preferably within 48 hours of the symptoms. So if you have those symptoms, you may not know whether it is swine flu or not, doesn't matter. I think come forward to see your doctor and let us assess it, and Tamiflu is available. The government has enough stock of Tamiflu to deal with the patients that are expected to crop up. So I think what is likely going forward in this part of the world as well is that you may begin to hear local clusters. And I think we should not be unduly shocked if it happens, because it may very well happen. For all we know, even as we speak, there may already be such patients inside in the community. So the response strategy must be to try to minimize casualties, minimize fatality. So far, if you look at the situation outside of Mexico, the cases look mild, meaning there is, as yet, no fatality, and the illness outside of Mexico seems self-limiting. I mean, there can be many explanations for this, and scientists, of course, are trying to figure out why this huge difference between high fatality rate in Mexico versus mild situation outside. One optimistic interpretation is that viruses tend to attenuate, become weaker as with each round of transmission, and probably that's what's happening here. But if it happened that way, then what it means is there will be many patients who may be infected, but the risk of death may not be as high as what we observe in Mexico. But as I said, there are a lot of unknowns to what is happening, because this is still an evolving, dynamic situation. Key point is, I think, all hands on deck. That is, certainly on the hospital side, we will act much more cautiously than necessary. So although you talk about color coding from green to yellow and orange, in practice, in the hospitals, we have moved into yellow even days before we declare so. And that will always be the case. So, for example, even today, we are start looking at, for hospitals, maybe some of the orange procedures will have to be put in place. So I think that is how we should react. I think for Singaporeans, you have important role to play. So I joined DPM-Wong in asking Singaporeans maintain a high standard of personal hygiene, wash hands frequently, and if you cough or sneeze, please use tissue paper, cover your mouth and nose. If you are sick, see a doctor immediately, listen to the advice, and stay at home. So that you do not spread the disease to outsiders, to other people. That way we protect everybody all around. And that way I think we can help to minimize fatality and casualties. Thank you.
Take a seat.